Did you know every 40 seconds in the United States, someone suffers a stroke? And those over 60, they're the most at risk, but also the most likely to miss the early signs. You see, many folks think a stroke comes without warning, that it just hits out of nowhere. But the truth is, the brain usually sends signals hours, even days in advance. We just don't always recognize them. A shaky step, one side of your face feeling a little off, or suddenly not understanding what your loved one just said. If we listen closely, we might save ourselves or someone we care about from lifelong disability or even death. In today's video, I'm Dr. Patel, and I'd like to walk you through 9 early signs of stroke in people over 60, all backed by science, with real-life examples and clear steps you can take if they happen. Because no one should have to pay the price of a stroke just because of a few minutes too late. Now let me ask you something gently. Have you, or someone you love, ever noticed something strange? Maybe a sudden slur in your speech, trouble balancing, or your vision going blurry for no clear reason. If you've seen anything like that, would you feel comfortable sharing it in the comments? I read every message, truly, and I do my best to respond with care and understanding, because your story might just help save another life. And if this video feels helpful to you, please feel free to hit subscribe. That way we can keep learning together and protect our health as we age, one small step at a time. Let's get started. 1. Sudden loss of balance. The warning sign that's often overlooked, but can cost a life. Now I know this might seem like something small, but have you ever suddenly felt dizzy, like the world was spinning, and your legs just wouldn't hold you up? Maybe you brushed it off, blamed it on low blood pressure or just a bad night's sleep. But here's what most folks don't realize. A sudden loss of balance could be your brain's first cry for help before a stroke. According to the Journal of Stroke and Cerebrovascular Diseases 2020, about 14% of strokes happen in the cerebellum or brainstem, the parts of the brain that control balance, movement, and spatial awareness. And among these cases, nearly 60% of patients had only mild symptoms at first, like dizziness, wobbling, or walking off to one side. Sadly, many were misdiagnosed the first time they sought care and lost the critical golden window for stroke treatment, usually just 3 to 6 hours. What's even more concerning, strokes in the brainstem are rarer but far more dangerous. This area controls your heartbeat, breathing, and full body coordination. So for folks over 60, when healing takes longer, even a small delay can lead to permanent disability or death. Let me tell you about Mr. Andrew, 67, from Texas. He was watering his garden one morning when he suddenly felt lightheaded. The trees started to spin and his legs just gave out. He tried to stand, but he stumbled like he'd had too much to drink. His wife thought maybe it was just the heat. She rubbed his back with some ointment, but just 45 minutes later, he couldn't speak. He was paralyzed. At the hospital, an MRI revealed a cerebellar stroke, and he was lucky to survive. Now here's what I want you to remember. In people over 60, a sudden loss of balance isn't just about getting older or weak joints. It may be the first sign of a dangerous stroke. As we age, our brain's ability to compensate slows down. And if blood flow is blocked in the cerebellum or brainstem, you might suddenly lose coordination, feel off-center, stagger, or not be able to stand still. Watch out for signs like sudden dizziness without a clear cause, wobbling, leaning to one side, or walking unsteadily, inability to stand with your eyes closed, nausea, vomiting, or slurred speech. Just imagine this. You're out for a walk in the park, and suddenly the ground feels like it's shifting beneath you. That's not just aging. It could be your brain sounding an alarm. So when should you seek help immediately? If you experience sudden dizziness, loss of balance, or stumbling to one side, especially if it comes with blurry vision, slurred speech, or weakness in your arms or legs, call 911 right away. Please, don't try to drive yourself. Let emergency responders help, because these strokes can escalate fast. And the good news, There are things you can do every day to help prevent brainstem and cerebellar strokes. Gentle exercise. Balance exercises, walking, or yoga can improve circulation and protect your inner ear and brain. A heart-healthy diet. Include omega-3 fats from fish, avoid excess salt, and stay hydrated. Monitor your blood pressure and blood sugar regularly, since high BP and diabetes silently damage the brain's blood vessels. Please never ignore the small changes in your body. Losing your balance might cause a fall, but if it's from a stroke, it can take away your independence, your mobility, even your life. If you, or someone you love, ever suddenly can't walk straight, don't just call it clumsiness. It might be your brain's call for help, and the moment you act could be the moment you save a life. 2. Dropping a glass, a wobbly step. When weakness strikes one side of the body, don't wait. It was just after breakfast. Mrs. Susan, 72, was rinsing a glass at the kitchen sink, when suddenly it slipped from her hand, shattered right at her feet. She bent down to clean up the mess and realized her right leg felt heavy, like it was glued to the floor. Her step became unsteady. Her arm lost its strength, but she told herself, "I'm just tired. Maybe I'll feel better after a rest." For those of us over 60, a sudden weakness in one arm or leg, like dropping something, walking with a limp, or dragging your foot, can be a classic early sign of stroke, especially if it happens on just one side of the body and comes on without warning. What's frightening is how easily this can be misunderstood. Many older folks assume it's just old age or a pinched nerve. But the truth is, when a stroke begins, blood flow to part of the brain gets blocked, and that area, the one that controls movement, begins to shut down within minutes. Harvard Health reports that for every minute a stroke goes untreated, we lose nearly 2 million brain cells. But if you get care within the first 3 hours, your chance of full recovery can be as high as 70–80%. If not, the risk of paralysis, loss of speech, or even death goes way up. Every year in the U.S., over 610,000 people have a stroke for the first time. Most of them are over 65. And here's the heartbreaking part. About 1 in 3 had warning signs days or hours before, but didn't make it to the hospital in time. Let me tell you about Mr. Martin, 69. He was playing chess with his grandson when he suddenly couldn't grip the piece with his right hand. He tried to stand up, but his right leg wobbled like it had lost its strength. His grandson acted fast, called 911 on the spot. Thanks to quick action and treatment within 45 minutes, Martin received clot-busting medication. Just 2 weeks later, he was walking again. If we'd waited even one more hour, he said, I might not have walked again. Please hear me when I say this. If you feel a sudden numbness, weakness, or loss of control in one arm or leg, even if it passes in a few minutes, call 911. Don't wait. Don't see if it gets better. Because when it comes to stroke, every minute counts. Now you can lower your risk, starting with simple steps. Get regular light exercise. Even a 30-minute walk a day boosts brain circulation. Monitor your blood pressure. High BP causes over 60% of strokes. Eat smart. More veggies, fish, and whole grains. Less salt and processed foods. Sleep well. Manage stress. Poor sleep and anxiety raise clotting risks in the brain. A dropped glass, a shaky step, they might seem like nothing, but sometimes they're whispers from your brain, trying to warn you before the storm. Listen to your body. Act quickly. You have more control over your future than you think. And please share this video with someone you care about, because protecting your brain starts with being aware. 3. Sudden blurred vision in one eye. When your eyesight fades, even for a moment, don't ignore it. It was a quiet afternoon in Ohio. Mrs. Ruth, 74, was reading the newspaper when the words on the page began to blur. Then, her entire left eye went completely dark. She rubbed her eyes, thinking maybe it was the dry air or the air conditioning. She laid down to rest, but just 3 hours later, she collapsed. By the time help arrived, her visual cortex, the part of the brain that processes sight, had already suffered severe damage, and her vision in that left eye was lost for good. Now here's the thing many people don't realize: when someone over 60 suddenly loses vision in one eye, or sees double, or experiences a strange flashing light, it's often not a problem with the eye itself. It's the brain, specifically the blood vessels that feed the visual areas in the back of the brain. And as we age, these vessels become more fragile, more likely to harden, and less able to bounce back from a blockage or bleed. A small clot, in the wrong place, can cause permanent blindness, or even be the first sign of an oncoming stroke. Studies published in the Journal of Stroke and Cerebrovascular Diseases 2021 found roughly 1 in 5 patients with an ischemic stroke had visual symptoms early on, such as blurred or lost vision, and over 60% of older adults ignored these signs in the first 24 hours, missing the critical window for treatment. Harvard Health Publishing also notes, when bleeding occurs in the brain's occipital lobe, the part that sees, it can lead to complete blindness in just 3 to 6 hours. So what should you look out for? Sudden blurred or dim vision in one eye. Seeing double, even just for a few minutes, bright flashes, like someone shining a flashlight in your face. A gray shadow coming over part of your vision. These symptoms may seem small, but they're your brain's way of crying for help. Please, do not wait to see if it clears up. Call 911 immediately. Do not try to drive yourself. Do not visit your eye doctor first. Why? Because the problem likely isn't in the eye. It's deeper, in the brain. And only a brain scan like an MRI or CT can tell you what's really happening. Now here's the good news. There's a lot you can do, starting at home, to protect your vision and your brain. Keep your blood pressure stable. It's the #1 way to protect your brain's blood vessels. Eat brain-friendly foods like salmon, spinach, blueberries, and broccoli. Take a 20-30 minute walk daily. It helps blood flow to your brain and eyes. Your eyes aren't just the windows to the soul. They're messengers. And sometimes they're the first to warn you when something's wrong in the brain. So if your vision suddenly changes, even just for a few moments, don't ignore it. Don't wait. That moment of action could protect your independence, preserve your quality of life, and save the light in your world, one eye at a time. Make a promise to yourself today. If your vision suddenly dims, doubles, or goes dark, act. Because by acting quickly, you give yourself the chance to see more sunsets, more faces you love, and more of the life that still lies ahead. 4. A slanted smile, slurred speech, and a life saved in time. It was just a quiet breakfast in Florida. Mr. Robert, 68, was smiling at his wife when she suddenly noticed something was off. His smile looked uneven. The corner of his mouth wasn't lifting like it normally did. She asked gently, "Are you okay?" But he couldn't answer. Only mumbled sounds came out, unclear, confused. Less than 30 minutes later, he was in the emergency room. Diagnosis: a stroke caused by a blockage in the middle cerebral artery. Now let me ask you something. Have you ever noticed someone smile and it looks just a little off? Or maybe they speak and the words sound slurred or strange. At our age, it's easy to assume it's just fatigue or that we slept wrong and one side of our face feels weak. But please don't brush it off. A drooping face, a slurred voice, or one weak arm could be your brain's first cry for help. After age 60, our bodies change, and sometimes those changes can blur the line between something small and something life-threatening. In fact, the American Stroke Association reports each year more than 795,000 strokes happen in the U.S., and about 87% of them are caused by blood clots in the brain. Older adults, especially over 60, make up the majority of severe cases. And here's the heartbreaking part. For many, the first signs were small, a crooked smile, a stuttered sentence, a strange feeling in one side of the face. But they were ignored. They waited. And by the time they reached the hospital, precious brain cells were already gone, for good. A study from Harvard Health Publishing found, if treated within 3 hours, stroke patients are 2 to 3 times more likely to recover fully compared to those who arrive after 6 hours. But sadly, only one-third of patients recognize the early signs in time. Take Mrs. Mary, 73. She once joked in the mirror that her crooked smile was from eating something too sour. Thankfully, her daughter acted fast. Today, she still walks, talks, and laughs with her family. So how can you recognize a stroke? Just remember this simple rule fast. Face. Ask them to smile. Is one side drooping? A. Arms. Ask them to raise both arms. Does one drift down? S. Speech. Ask them to say a simple sentence. Is it slurred or strange? T. Time. If any of these signs appear, call 911 immediately. Do not wait. Do not see if it goes away. Every minute matters. The good news: you can protect your brain, starting right now. Move your body each day. Even 30 minutes of walking helps blood flow. Eat heart-healthy foods, leafy greens, fatty fish like salmon, and less salt. Sleep well, manage stress, and take your medications regularly, especially if you have high blood pressure, diabetes, or heart disease. And finally, a crooked smile or a single slurred word might not seem like much, but sometimes it's the brain's final warning before the storm. So please don't wait. Act. Because when you act fast, you don't just save your own life. You preserve your conversations, your laughter, and your place in the memories of the people who love you. If this message resonated with you, please share it with someone you care about, especially those over 60. Because early awareness is the first step to lifelong wellness. 5. Suddenly, they can't understand what you're saying. Now just imagine this. You're sitting with a loved one over breakfast. You ask a simple question: would you like tea or coffee? But instead of answering, they just stare at you. Their eyes seem lost. And all they can say is, the thing outside. It's, you might think they're just tired, or maybe confused from lack of sleep. But please, don't assume it's just old age or a bad morning, because what you're seeing could be a warning sign of a stroke affecting the language center of the brain. Our brain has a special region, mostly on the left side, that helps us understand and express language. And when blood flow to that area is suddenly blocked, the person may still hear you clearly, but they can't make sense of your words, and they can't form sentences the way they normally would. They might start speaking nonsense, use the wrong words, repeat phrases that don't make sense, or go completely silent. Now here's the difficult truth. In people over 60, even a small stroke in the language area can have a major impact, because the brain doesn't heal as quickly as it used to. And worse, this kind of confusion is often mistaken for normal aging stress or a side effect of medication. That delay in action can cost someone their ability to speak forever. Take the story of Eleanor, 75. One morning while having breakfast with her grandkids, she suddenly couldn't answer a simple question. She looked confused, mumbled broken words that made no sense. The family thought she was just tired, but an hour later, she collapsed. The diagnosis: a stroke in the Broca's area, the language center of the left brain. Studies from Harvard Health Publishing show nearly 35% of ischemic strokes begin with language problems, and over 40% of older adults with strokes experience difficulty either understanding or expressing speech. The Journal of Neurology warns, if not treated within the first 3 hours, damage to the language center can become permanent even if the person remains fully awake. So what should you watch for? They suddenly can't understand simple questions. They speak in gibberish or use the wrong words. They repeat a single phrase over and over. They stop speaking altogether or stare blankly. If any of this happens, call 911 right away. Don't wait for them to snap out of it. Every minute counts, literally. The good news is, you can reduce your risk with some daily habits. Keep your brain active. Read play puzzles or learn a new skill. Control your blood pressure, especially if you have a history of hypertension or atrial fibrillation. Eat brain-healthy foods. Berries, fatty fish, and dark leafy greens support both brain cells and blood vessels. So please, don't ignore a repeated phrase, a blank stare, or a moment of silence that feels off. Your brain is trying to speak to you, even when your mouth cannot. Every moment you wait is a memory, a word, a connection that could be lost forever. Act fast, get help early, and trust that, if caught in time, you or your loved one can still speak, still share stories, and still be heard. One precious word at a time. 6. Sudden falls. And no memory of what happened have you, or someone you love, ever fallen suddenly, with no warning, no tripping, no slipping, and later they couldn't even explain what happened. At this age, a fall isn't always just a simple accident. Sometimes it's your brain trying to sound an alarm. You see when someone suddenly loses control of their muscles or briefly blacks out, even for just a few seconds. It could mean there's a problem deep inside the brain, specifically in the brainstem or cerebellum. These areas control movement, balance, and awareness. In older adults, especially over 60, the risk of circulation issues, balance problems, and nerve decline goes up. Muscles get weaker, bones become more fragile, and one fall, even a light one, can lead to broken bones, head injury, or long-term disability. But what's even more serious is when a fall is the first sign of a minor stroke or brain bleed. And if we miss that signal, we also miss the golden window to protect the brain. Let me share the story of Mr. Thomas, 74, from Seattle. One morning he was out for a walk. Suddenly he collapsed onto the sidewalk. He couldn't explain it. People helped him up, but he had no memory of what happened. At first his family thought it was just low blood sugar, but at the hospital an MRI revealed a mild brainstem stroke. He had briefly lost consciousness and temporarily lost muscle control. Thanks to quick action, he fully recovered, but just a little later, and things could have been very different. According to a study in the Journal of the American Geriatric Society 2019, over 30% of people over 65 fall at least once a year. About 15% of those falls are due to central nervous system issues, like mini strokes or vestibular dysfunction, but only 1 in 3 are correctly diagnosed the first time. And the CDC warns falls are the leading cause of injury-related death among people over 65 in the U.S. So please pay attention to this. If someone falls without a clear reason, no trip, no slip, take it seriously. If they're confused, slurring their speech, or seem weak after the fall, call 911 immediately. If they have a history of high blood pressure, atrial fibrillation, or diabetes, their stroke risk is even higher, and don't ignore it just because they were standing still or walking slowly. That's exactly when stroke-related falls often happen. You can reduce these risks with simple habits at home. Practice daily balance exercises. Tai Chi, gentle yoga, or just standing on one foot can strengthen reflexes and stability. Eat foods rich in vitamin B12, D, and omega-3s. They support nerve signals and muscle strength. Monitor blood pressure and blood sugar regularly. Sudden drops or spikes can cause brief blackouts. Falling, at our age, is never just a small thing. Sometimes it's the brain's quiet cry for help before a much bigger stroke hits. So if you've ever fallen and didn't know why, please don't just brush it off. Don't just get up and move on, because staying balanced isn't just about your feet. It's about keeping your entire life steady, strong, and within your reach. 7. Numb arm, slurred speech. Then it goes away. Please don't assume you're fine. Have you, or someone close to you, ever had something strange happen, like your arm suddenly going numb, or your speech becoming slurred, and then a few hours later, everything seems fine again? If that's ever happened, especially after age 60, I want you to know something important. It's not nothing. In fact, it might be your brain's first and only warning. What you experienced could be a TIA, a transient ischemic attack, or what some call a mini stroke. And while it may go away on its own, the danger doesn't. TIAs are temporary, yes, but they're often the body's last signal before a real stroke hits. Let me tell you a story. One morning, Mr. Henry, age 70, was putting on his shirt when his right arm suddenly gave out. The shirt fell to the floor. His wife asked what was wrong, but his words were jumbled. like he had just woken from a dream. 30 minutes later, everything seemed normal again. He said maybe it was low blood sugar. 2 days later, he had a major stroke. This time he lost the ability to move his right side and could no longer speak. According to the New England Journal of Medicine, about 15% of people who suffer a major stroke had a TIA just before. And the risk of a full-blown stroke in the next 24-48 hours, it can be as high as 20% without proper treatment. But here's the hopeful part. The American Stroke Association reports that 80% of strokes can be prevented if we act right after a TIA. So how can you recognize a TIA? It comes on suddenly, often within minutes, causes temporary symptoms like arm or leg weakness on one side, slurred speech or facial drooping, dizziness, or even brief vision loss. Then it goes away, usually within 15 minutes to a few hours. But just because the symptoms vanish doesn't mean the risk is gone. If this ever happens to you or someone you love, please don't wait to see if it comes back. Get to the ER right away. That window of time may be your one chance to prevent a devastating stroke. And yes, there's a lot you can do to reduce the risk. Monitor your blood pressure daily and never stop your medication just because you feel okay. Make small lifestyle changes. Quit smoking, cut back on salt, and walk 20-30 minutes a day. Sleep well and manage stress. Because poor sleep and long-term stress can quietly increase clot formation in your blood vessels. And one more thing, if symptoms appear, write down exactly when they started and when they ended. That information can guide your doctor in choosing the right treatment. TIA leaves no scar on the body, but it leaves a warning. Please don't ignore it, because what you just went through might have been your last clear chance to stop a stroke before it changes your life forever. Living well isn't just about avoiding illness. It's about listening when your body whispers before it screams. So if something strange happens, even for just a few minutes, don't brush it off. Go get checked. You might be saving your future. 8. Fainting for just a few seconds. Please don't ignore it. It might seem like nothing. Just a brief moment. A sudden fainting spell that lasts a few seconds. Then everything feels normal again. But if you're over 60, that moment could be your brain's quiet cry for help. According to the Journal of Neurology, Neurosurgery, and Psychiatry 2020, about 7% of strokes in older adults begin with a short seizure or sudden loss of consciousness, especially in those with high blood pressure, diabetes, or hardened arteries. But here's the real danger. These events are often brief, and the person wakes up feeling mostly okay. So families think he just got lightheaded. Maybe his blood sugar dropped, and they let it go. But data from the American Heart Association warns when a stroke starts this way, in the brainstem or cortex, the risk of death can be 30% higher if treatment is delayed. Let me share a real story. Mr. Michael, 73, was standing up from the table when he suddenly collapsed. His body twitched slightly, then he blacked out, just for a few seconds. When he came to, he was confused, breathing heavily, and couldn't remember what happened. His family assumed it was low blood pressure and let him rest. But by the next morning, he couldn't speak clearly. His right arm felt weak. A brain scan later confirmed he had suffered a brainstem stroke, beginning with that brief loss of consciousness and mild seizure the night before. If you're over 60, any episode of fainting or seizure-like movement, no matter how short, should never be brushed off, because your brain isn't as resilient as it once was. Your blood vessels are more fragile, and even a small disruption can be a warning of a much bigger stroke coming soon. Watch for a sudden blackout, even just for seconds, mild twitching or tremors in one side of the body, confusion or fogginess afterward, not remembering what just happened. Please don't assume it's just getting older, especially if you've had high blood pressure, diabetes, or previous signs of poor brain circulation. If you or a loved one ever passes out, even briefly, call for help. An MRI or CT scan can catch small injuries in the cortex or brainstem before they turn into something much worse. The older we get, the faster we need to act. Loss of consciousness is never just a small thing. It's the brain knocking on the door and hoping you'll answer before it's too late. Your life doesn't depend on whether or not you fall. It depends on how quickly you stand back up and what you do next. So if you or someone close to you has ever fainted, even once, please don't wait for next time. Go get checked, because knowing early might give you back years of clear thinking, independent living, and peace of mind. 9. The worst headache of your life. Don't wait another second. Mr. James, age 71, was sitting quietly reading the newspaper when suddenly he felt a sharp, explosive pain at the back of his head, like someone hit him with a hammer. Sweat poured down his face. His skin turned pale. His hands began to tremble. And then he started vomiting over and over again. His family thought it might be a migraine, or maybe just the flu. They reached for essential oils and pain meds. But just 20 minutes later, Mr. James lost consciousness. At the ER, doctors diagnosed him with subarachnoid hemorrhage, a type of brain bleed caused by a ruptured blood vessel. This is not a rare story. It's something that happens every day, but is often missed. A sudden, severe headache, described as the worst headache I've ever had, that comes on like lightning, is a classic sign of brain bleeding or a ruptured aneurysm. When a vessel in the brain bursts, blood floods into nearby tissue, creating pressure inflammation, and often permanent damage within minutes. Especially after age 60, our blood vessels become more fragile. If you also have high blood pressure, arterial plaque, or an undiagnosed aneurysm, the risk is even greater. The scary part. Many older adults tolerate pain well, so they dismiss the headache as just another migraine, or probably my blood pressure again. But the truth is, delaying even an hour can lead to permanent brain damage, coma, or death. According to the American Heart Association, 5 to 10% of all strokes are caused by brain hemorrhages like this. And of those, nearly 50% die within 30 days if not treated quickly. A study in the Journal of Neurosurgery found that 43% of seniors with brain bleeds didn't recognize the signs early enough because it felt too much like a normal headache. Here's how to tell the difference. The pain comes on fast and intense. Like a thunderclap, it may include nausea, vomiting, light sensitivity, or neck stiffness. There could also be confusion, slurred speech, weakness, or unconsciousness. If even one of these symptoms appears, call 911 immediately. Don't take aspirin. Don't wait to see if it goes away. Only a brain scan, a CT or MRI, can confirm if there's bleeding, and only fast treatment can save your life. So please, if you ever feel a headache that's unlike any you've had before, don't try to tough it out, especially if you're over 60. Every strange symptom deserves to be heard. Every signal from your brain is worth checking. Loving yourself sometimes means not ignoring the cry for help inside your own head. One quick decision could save your life, your memories, and the conversations you still want to have with the people you love. My friend, if you've ever felt lightheaded, wobbly on your feet, or suddenly lost strength in one side of your body, please don't keep it to yourself. Share your experience in the comments below. I read every single one, and I respond with the care of someone who's also past 60 and understands what these signs might mean. If today's video helped you, feel free to tap subscribe so we can meet here again next week and gently learn how to care for ourselves in ways that are simple and real. And if you've gone through something like this, or even worried you might, share your questions or story, because sometimes what you're facing silently is exactly what someone else is afraid to ask out loud. Thank you for spending your time here. May you stay aware, stay strong, and live fully in every single moment of every single day.